As you might know, my pro bono work, it is the one related to the role I have with the Women's Brain Project. I am the pro bono chief executive officer of the Women's Brain Project and one of the co-founder. This organization was founded in Switzerland in 2017 officially, and it is an association that is now moving towards the establishment of a foundation that will operate the first sex and gender precision medicine research institute in Switzerland with a worldwide reach out. So we are specialized in analyzing sex and gender differences, above all when they might have an impact on brain and mental diseases. And we have to say that majority of brain and mental disorders do have a difference in terms of prevalence and incidence between men and women. They mainly impact the female population. So we realized, nevertheless, that it's not only a matter of numbers, but also differences or characteristic, as we like to define them, that refer or might refer to the symptoms of the disease, the progression of the disease, the way we diagnose the disease, and finally, the treatment response and the adherence to a given treatment. So there are differences between men and women which are profound. They were neglected in research for a very long time. And finally, thanks to our work, which has been pioneering, those differences are addressed and discussed at the moment within the scientific community, within the drug developers community, and all the stakeholders involved, including policymakers and regulators. This is where we are very strong upon. We are a cross-functional team speaking with multiple stakeholders, including digital developers like Altoida. My real job, in fact, it is being the chief medical officer at Altoida. And why I developed in this role in a very, let's say, natural fashion, simply because I was cooperating with this startup on a pro bono basis as an advisor. And I asked the scientist at Altoida back then whether the device was not only capable of measuring cognitive impairment in individuals, but also whether the machine learning that was trained to measure cognition, motoric functions, executive functions, and other type of measurement related to the way we function with our brain, but also how our brain controls the body, would have been able to predict whether the person taking tests would have been a woman or a man. So this is the first digital objective biomarkers that, in my knowledge, can really discriminate and say this person taking the test highly likely is going to be a man or highly likely is going to be a woman. So it's sensitive to this parameter, proving the hypothesis we had at the Women's Brain Project that those sex and gender differences are existing, profound, objective, and can even be measured now by digital biomarkers. I can tell you that we have a multitude of research projects, and the major outcomes for this year of this research have been the patient journey survey that we did, and it will result in a publication soon, where we learned that profound sex and gender differences exist across the entire patient journey of people living with Alzheimer's disease or respective caregivers. We've also done a major research work together with the Economist Impact, where we have been able to characterize the economical impact that missing sex and gender-driven research might have on the returns of investment for drug developers in both the preclinical phase, but also in the second phase of development, and most importantly, what it means also sex and gender differences when they got neglected for the society and the cost of the healthcare system. What we learn is that sex and gender differences have a profound impact even on the GDP of a country, because we know that women, being the major affected population of those chronic neurodegenerative disorders, or in general brain and mental diseases, will be lacking of the capacity of being productive at work, or they will have to dedicate their time to caregiving, very often unpaid. And all these features have a profound impact, as we said, on the GDP of a country. It must be therefore taken into account by any governmental agenda that this is a priority to be addressed. We need to fulfill this gap. And there is much more than the economic gap when we speak about women. There is the health gap that, in my opinion, it is the first one to be addressed and resolved, because if we are not healthy, if we don't have access to the right care, if we are discriminated in terms of the treatment that we can achieve, then we will not be productive, and the economic gap won't be solved anyhow. So it's not only about the economical return, but it's also the health return of an individual.